Dr. Khalil Masri, who is a cardiologist from Michigan, has a lot to be grateful for this Thanksgiving.
I know my stay in the house was 230 some days.
He contracted COVID-19 last year and would eventually need a double lung transplant.
Just being in the medical field, I never said, why did this happen to me? I was trying to be realistic. I was optimistic. I always had a smile. Everybody would tell you. I would be on the vent and smiling.
Masri got sick before he had the chance to get vaccinated. The virus quickly took hold of his body, and before he knew it, he was fighting for his life in the ICU.
When he arrived in our ICU, he was actually quite ill, mechanically ventilated, and we had to almost immediately put him on a ECMO just to stabilize him.
Dr. James Yoon is a lung transplant surgeon for Cleveland Clinic. He says Masri was transferred here at the request of his family.
When he first came, he was not a candidate for transplant. He was actually too sick. He had infections. He was unstable, and it was not appropriate at that time. However, with our ICU team, nurses, respiratory therapists working on him for a good probably 6-7 weeks, we were actually able to get him in position, even though he was still on ECMO therapy for that entire period, to be considered eligible.
A couple of weeks later, Masri was able to find a donor and was immediately taken into surgery. Everything went well, but recovery proved to be a challenge.
There were still many hurdles, and he needed a couple of procedures to eventually continue his transition off the ventilator.
Masri says it was a tough battle, but he never gave up and has his family and medical staff to thank for that.
Like occupational therapy, physical therapy, all the nurses, the aides, everybody plays a big role.
He also has a message for those who haven't been vaccinated yet.
Be considerate of others around you. Get vaccinated.
For Cleveland Clinic, I'm Brittany Harris.